All right, so today, you guys can hear me, right?
Yeah.
Okay. Today we're going to talk to you about infection control in the dental setting. My name is Jess Danko. I have a background in healthcare administration. I also am a respiratory therapist as well as an infection preventionist, certified for the long-term care setting.
My name
Yep.
is Stephanie. My name is Stephanie Popowski-Dahl, and I am a registered nurse.
We come to you from the South Dakota Foundation for Medical Care. Uh, that is a nonprofit organization that's based in Sioux Falls, South Dakota. We all work from remote locations to complete the work for the foundation. The work that we are presenting and sharing with you today is an initiative called South Dakota Project First Line. So what that is it's a collaboration with the CDC to provide infection prevention education for frontline healthcare workers. So dental definitely falls into that category. It was kind of born out of a need to quickly come up with and distribute infection prevention education at the start of COVID. And now it's evolved into being able to just share the general and standard practices of infection prevention to any healthcare setting that has a need. So today we're going to share some best practices in infection control. We're going to explore ways to prevent the spread of bacteria. And then we're going to discuss reservoirs and where bacteria live. So right now I have 3 pictures up here, and your teacher might have to kind of pass along your answers. I don't know if I'll be able to hear you guys very well, but can you guys tell me what's wrong in the first picture there for an infection control concern?
Not wearing a mask.
Not wearing a mask, yep. When you go into the dentist now, since COVID has not become such a heightened concern, some dental settings and dentists will not necessarily wear a mask until they start to do their um, exam or work on your teeth. Any other guesses on that first picture? How about I just share the answer on that one? If you look at the lady that I'm assuming is the dentist or dental assistant, she has her gloves on, which is fantastic. However, she's got her hands crossed and she's touching her lab coat. That could be covered in germs from another patient, or maybe her gloves had germs on it and now she's just put that on her lab coat. So really consciously thinking about, okay, I put these gloves on, now what am I touching? All right, in the next picture, you guys already guessed it. She doesn't have that mask on when she's going to work on the patient. And what do you think about that last picture? What's the concern there? Any guesses?
Any thoughts?
None? Well, this one actually has to do with the mask again. Look at it down below her chin. Yep. That is a big concern and hazard for anybody that wears their mask down around their chin. When you think about it, when it was up and over your face like you should appropriately wear a mask, that mask is collecting every germ that has come into contact with your face area. And now you've put that down below your chin where you're pulling in and breathing air. So you're essentially just breathing in all of those germs right up into your nose and your airways. So pulling that down below your chin is almost worse than just not having one at all. So, all right, let's go on to the next slide here. So what I want you to do is I want you to think about this. A lot of times we present this for clinics and that type of thing, but it also can apply to you guys. What do you think are some weak links when it comes to infection control in the dental setting? Any guesses or ideas?
Not washing hands enough.
Not washing hands enough. Absolutely. That hand hygiene is a huge part of infection control. We are going to talk about that here in just a little bit. Any other thoughts? So a lot of times when we talk to the dental setting, we come into things like confusion on maybe some policies. So, what do they have in place for policies? Um, Other things that we talk a lot about and we'll share with you guys today are topics such as cleaning and disinfection. So, things like, are you keeping your surfaces wet for the right amount of time? Something called kill time. Um, are you cleaning your instruments appropriately? Those type of things. So those are kind of where we find the weak links. And to help prevent that, and here's a picture kind of looking at that. So the policies are on here, that hand hygiene's on there. Needle safety is a huge concern, even for the dental setting, and then that PPE. So what we do when we go to these facilities is we really work to fix that leak. So how do you fix it? Education is a key component to infection control, um, knowledge and staff and you guys as people going into the dental setting to appropriately protect yourself from infections, as well as those patients that you're serving in the dental chairs. So I mentioned policies and procedures that has been one that we are finding a lot of concern around. And really what policies and procedures are put into place for is so those that work in the dental setting know what practices they're supposed to be following, know what procedures they're supposed to keep in order to ensure best practices within that setting. So they have to be assessed at least every year once they are put into place. So maybe there's a policy for hand hygiene that says you have to wash your hands at this time, you need to use soap or hand sanitizer, that type of thing. But then it needs to be looked at annually to make sure it still meets with what the current times are, such as during COVID, we certainly heightened our awareness of hand hygiene and PPE in comparison to maybe what was going on prior to that. We have seen a lot of policy changes and implementation since the start of COVID. Other thing in the dental setting is the requirement is that there's one person within the clinic or the office that is required to really be trained and educated in infection prevention, and then has that responsibility in their work as the one responsible for making sure the policies are up to date, making sure that training and education is done and shared with those that are working in the setting. So really just making sure that the office is covered completely on all policies and not just infection prevention, but there might be other policies that are needed within the setting. Do you guys have any questions on that? Okay. So the first thing I want to talk to you guys about when we start talking about infection control practices are what are called standard precautions. So these are the protections or the precautions that are put in place to protect you as the provider from things such as blood, body fluids, secretions, and excretions. That doesn't include sweat. So if a patient's sweating, that is not necessarily a huge concern. The one thing that you really need to keep in mind in the dental setting is saliva is something that you guys obviously are going to work with, and that is part of the standard precautions. The reason for that is because we're trying to protect from those bloodborne pathogens, HIV, hepatitis concerns, if you are exposed. So that's what standard precautions mean. So it's that protection and precautions from the human body fluids. As I mentioned, and you guys talked about, one of you mentioned already, hand hygiene. So when do you have to do it? There's different needs when you're just out in your day-to-day activities compared to when you're in the dental setting. Yes, you should always wash your hands before and after going to the bathroom, before and after you eat. But then when you get into the healthcare setting, there's some other times you really need to think about. Obviously, when visibly soiled, both in and out of the dental setting. Something else though is if you're barehanded and you touch an instrument or equipment, whether that has been used or not, and if you don't have that knowledge, you could really be transferring some of those pathogens that I just mentioned by touching it with your bare hands. Sometimes there's a microscopic little tiny cut on your hand, and if you touch that with your bare hands, that's considered an exposure if that gets into that cut. So before and after touching in, or after you've touched an instrument with your bare hands. Before and after treating a patient, always before putting on your gloves, and always immediately after taking off your gloves. So that's a key one that sometimes we see healthcare providers forget, is that before putting on my gloves, I need to make sure I do hand hygiene. That can mean using that alcohol hand sanitizer. The thing with that is you need to get one full squirt or pump, and then you need to rub your hands together until that's dry. If you don't, you're not giving the alcohol sanitizer the time to effectively clean and disinfect your hands. So really keep that in mind if I'm using that hand sanitizer versus washing my hands in the sink, to make sure I'm rubbing my hands together until that's dry to get that done. How long do you guys need to wash your hands in the dental or healthcare setting? Do you know? Any thoughts or guesses? So within the healthcare setting, it is required that you wash your hands for a minimum of 15 to 20 seconds. That's to ensure that, with soap and water, of course, with that vigorous rubbing, that's to ensure that you are getting those germs off of your hands, and then to thoroughly dry them when you are done washing your hands. All right, so the next one we're going to talk about is PPE. PPE stands for the personal protective equipment. So some things you guys are probably absolutely aware of is the mask. We've all had to wear those because of COVID. Other things in the setting, however, include gloves, your goggles and face shields, and gowns. So when donning PPE, which donning means putting on PPE, there's a sequence you must follow to ensure you're properly protecting yourself and keeping the germs where they are. So first thing you need to do is put on a gown. I know some dental facilities don't require this. It is a recommendation and a best practice, but also keep in mind, depending on where you work, it's to follow your policy and procedure that is in place. When putting on gowns, however, there are ties at the top that a lot of times we see people avoid tying up. If you leave those flaps open in the back and it's flapping around, there's a high likelihood that even if you don't think it's going to happen, you can have exposure to, let's say, water spraying up when you're providing your dental procedures and landing on your back. So then you've contaminated your clothes. So that's kind of the reason for making sure you're tying up all the ties on the gown, is to make sure it's properly sealed. The other one is, a lot of times gowns have about mid waist, they have a tie there. We have seen, especially when you're in a hurry, people not tie those up. And what happens? They drag around on the floor. So then what? The floor is one of the dirtiest places in a facility. You're walking all around with it on it with your shoes, and who knows what's on the bottom of your shoes. And now those flaps or those strings have drug around on the floor and picked up all kinds of germs. So really making sure that you are getting everything tied up on gowns if you are wearing them. That next one is the mask. You guys all probably have some familiarity with the mask. There are different ones. So a surgical mask is not the same as something such as an N95 mask. If your facility uses N95 mask, those are ones that require a respiratory fit test. So they want to ensure that it is properly fitting to your face to provide you the protection that it's intended to provide. So they do something that what they do is they have you put it on, seal it up over your nose, and then they spray a fragranced scent. And if you can smell that, that means that your mask is not fitting appropriately. You either need a different size mask, or maybe a mask isn't going to, that type of mask isn't going to work for you. If you can't smell anything when they're spraying it, you're good to go. That mask fits the way it should, and you can use that for your protection. Goggles or a face shield is a huge one. You guys will work close proximity to patients. The likelihood of sprays from working in a dental patient's mouth is probably more heightened than just in the regular healthcare setting, obviously, because you're working on the teeth and spraying water in to help, clean stuff off and suctioning. So all of that, to keep in mind that goggles or that face shield become a key part of your personal protective equipment. Reason being is germs can enter through your eyes. So if something is sprayed up and it landed on your eye, that's a direct pathway into your body. Just like if you had germs on your hands and you touched your mouth. It's no different with your eyes as it is something such as your mouth. And then that last one is gloves. These are a huge importance. I already mentioned, like if you had a tiny cut on your hand and happened to touch saliva or some blood, that's a direct exposure for you guys. So just like there is a requirement for putting on PPE in that order we just talked about, there's a requirement for taking it off. So you appropriately keep the germs housed within that PPE. When you take it off, they call that doffing. So for PPE removal, you first take off the gloves, then the goggles. So kind of the opposite of what we just talked about. Then the next part is the gown comes off, and then your mask, and of course, washing your hands or using that alcohol-based hand sanitizer immediately after taking off that PPE. There is a video on here. I have included it if you guys want to go and watch them. They're put out by the CDC, and it actually shows you the process for putting on and taking off this PPE. The one that's probably a little bit more important is this doffing one for you guys. If we have time at the end, I can certainly pull it up. However, if not, you guys can go out and watch this on your own, but it shows you how to appropriately remove your gloves so you roll them into one another. How to appropriately take your gown off so you're rolling it kind of like into a ball, those type of things. All right, the next one I'm going to talk to you guys about or mention is this bloodborne pathogens and needle sticks. Just like I mentioned to you guys, if you had a teeny tiny cut on your finger and you touched an instrument, you had a bloodborne pathogen exposure, then is what they would consider that. The same would be for needle sticks. So sometimes people think, it didn't hurt, or it barely punctured the skin, no big deal. Do you think that's the case? Does it really matter if you get a needle stick? Any thoughts on that? You guys are a pretty quiet group. So a needle stick can be a huge thing. Even if you think it's just a teeny tiny puncture, that can be a direct exposure for you for something like HIV or hepatitis. B and C are some big ones right now that we're seeing across the state of South Dakota that are spreading, partially because we are seeing an increase in drug use, and drug users tend to share needles. So the spread is heightened. But you are going to have no idea, likely have no idea. Maybe it would be indicated in your patient's chart if they have something like hepatitis B or C or HIV. If you got stuck by a needle from one of those patients, you just exposed yourself and likely will contract that illness or virus also. So first thing with the needle stick, if you get a needle stick, even if you think it's super minor and not a big deal, go and wash your hands. Wash with soap or wherever. Wash that area with soap and water. Get it washed up really, really good. And then you need to go and report that to whoever, either your supervisor, whoever's in charge of your occupational health or your infection prevention program. So yes, needle sticks, absolutely matter. So do those exposures to things like bloodborne pathogens. This can be the difference between taking antibiotics for a couple weeks or having to be on lifelong medication because of a simple exposure to something like this. All right, I think you guys have listened to me talk enough. I'm going to go ahead and let Stephanie share a little bit here.
Alrighty, so now we're gonna start, or we're gonna talk about preparing injections. Injections are required to be prepared using an aseptic technique in a clean area free from contamination or contact with blood, body fluids, or contaminated equipment. So do make sure that you do have a separate area where you are drawing up your injections so there is no chance of contamination there with the needle. Next slide. So sharps and medical waste, all sharps, they need to be disposed of in a puncture-resistant sharps container located as close as possible to the area in which the item is used. Sharps containers also need to be disposed in accordance with the federal, state, and local regulated medical waste rules and regulations. So make sure that you do have a policy for that. Um, you know, you're aware of that, how to dispose of your sharp containers. Next
Just
slide.
gonna add, if
Oh, yeah.
you're sharp containers, if you're in your dental setting and you come across a container that's full, never ever stick your hands into it or try to shake it to get them to go down so you can put another needle in there. If you come across one that's full, it has to be replaced. Otherwise, you guys are talking about a huge potential to come across an exposure with the needle stick. So if you notice something's full, ask where to replace it, how to replace it, those type of things.
All right, now we're going to talk a little bit about cleaning precautions. So there is a difference between cleaning and disinfection. Cleaning is the removal of foreign materials, soil, dust, organic material from objects, and is normally accomplished by using water with detergents. Disinfection is the elimination of many or all pathogenic organisms except bacterial spores. They have their own way of needing to be cleaned. Surfaces must be cleaned before they are disinfected. Next
I,
slide.
I'm going to jump in here just because
Oh,
I
sure.
like to talk and interrupt. So, just because I want to explain this, you guys totally understand this. So, if I noticed let's just say a blood splatter on my counter in a patient room where you guys have been doing a procedure or something, if you just wipe that up, that is not necessarily disinfecting it. If maybe you can't see the blood anymore, but you just wiped it quick with a wet rag, that doesn't mean it's disinfected. And Stephanie's going to talk a little more about that. But I want you to understand there's a big difference between cleaning, where you've just made the appearance of something go away, versus actually disinfecting that surface or that tool or instrument that you're using.
So you guys might call it contact time, dwell time, wet time. You might hear different people call it different things, but what that is the time a disinfectant must be in contact with the surface or device to ensure that there is appropriate disinfection. So the surface needs to remain wet for the required contact time, dwell time, or wet time. So if you are wiping something down with, let's say, a sanding wipe, you have to be aware um, what what the time is that it needs to be wet. Um, you wipe it down. Let's say it dries before your contact time um, that is required. Then you have to wipe it down again and make sure that it does stay wet for that appropriate time to make sure that proper disinfection does occur.
I'm just going to point out last week, Governor Nome proclaimed the state of South Dakota as cleaning week for the entire state. The picture on here came to us from Daily Dental. You can see right there, he's using one of those wipes that Stephanie just mentioned to wipe down the machine there. So on that container, it tells the dentist or whoever's using it and cleaning that It needs to stay wet for that 2 minutes or 3 minutes or 10 minutes. Some products say a surface has to stay wet for up to 10 minutes. So really understanding what your cleaning product is and how long that surface has to stay wet becomes super important.
All right, there are some major changes to the hazard communication standard. The hazard classification provides specific criteria for classification of health and physical hazards, as well as classification of mixtures. Labels, changes there. Chemical manufacturers and importers will be required to provide a label that includes harmonized signal word, pictogram, or hazardous statement for each hazard class and category. Precautionary statements must also be provided. The safety data sheets, now they're going to have a specified 16 section format. And information and training, the employers are required to train workers on the new label elements and the safety data sheet format to facilitate recognition and understanding. So you will need to be aware of where your safety data sheets are in case of you would be exposed to a chemical or something that could be hazardous to you. So
Those safety data sheets would tell you something like, oh, I just got this bleach in my eye. What do I need to do? Does that mean I need to wash my eye out for a certain amount of time? Or does that mean whatever it might be that you need to do for that certain product? Every cleaning product has a label on it. If you have a cleaning product in your facility where you work that does not have a label, it should not be used. It is a requirement. It is a law that the cleaning products that you're using are labeled. Um, I was gonna add something else. Oh, so we have this picture here of a cleaning label. The one thing that you look for, if you notice on here, it tells you how long is that contact time. It's in that very bottom box there. So that one looks like 10 minutes, which is a long contact time for a cleaning product. If you think about that chair in the dental office, if you're using this product to clean that chair, that means that the entire surface of that chair has got to be wet for 10 minutes before it is considered disinfected and ready for the next patient's use. Did you have more to share on that,
nope.
Stephanie? Okay.
Nope. Alrighty, so the EPA is where we do get our information regarding the disinfections and making sure the disinfectants and making sure that we are using the correct disinfectants for killing certain viruses and bacteria. So if you do have any questions, make sure that you do go to that site regarding that, because we do want to make sure that we are killing the right using the right disinfectants to kill the germs. So extremely important.
A lot of times on the back of your cleaning product label, again, it will tell you that this product kills germs X, Y, and Z. So at least you know that usually it's a pretty broad spectrum. However, some germs, like Stephanie said, require a different type of cleaning product.
One other thing to remember is no corrugated cardboard containers. Items should be removed from the shipping cartons and boxes. Outer shipping boxes should not be left in clinical areas due to the risk of environmental contamination. Supplies should be stored in plastic washable containers. One thing to add to this, we were doing a training and we were talking about how we might bring in Girl Scout cookies, let's say in a cardboard box. Those sort of things you also have to remember, be aware of your personal items that you bring in. Not saying that you would have anything on them, but you just never know. There is that potential that we could be bringing environmental contaminants in. So make sure you keep your personal items away from medical supplies and stuff like that. But definitely make sure that you're not storing anything in cardboard boxes in your storage rooms.
And really just think about that. These boxes come in on a shipping truck, and it could be from a country away. It could be from multiple states away. They bounced around in a truck with who knows what next to it, what kind of bugs were climbing around in the truck, what kind of dust and contaminations are in the air that have all absorbed into these little corrugated crevices in this container, which then in your facility can really basically leak out or crawl out or come out and contaminate your areas too.
Bacteria and infectious diseases, a lot of pathogens here. You can see their survival time. It's kind of scary to see some can last from hours up to years. So disinfection is very, very important. MRSA, that's greater than 12 months. VRE, you've got your C. diff there. That is the spores. That has a special way of cleaning. If by chance you do know of anybody that does have C. diff, that you cannot use the alcohol hand rubs. You do need to make sure that you are washing your hands with soap and water. That's one thing to remember too. I guess not everybody comes in is going to tell you, yes, I have C. diff. So, and you can't tell with that, so make sure that you are washing your hands at the appropriate times with soap and water. The
So,
new emerging Go ahead.
oh, I was just going to say for C. diff, the telltale sign of that is somebody having diarrhea. So if somebody happens to mention or they have to hurry up and run out of the chair because they say they're sick to their stomach, that might be a something, a light bulb that should come on in the back of your head, like, I need to make sure I wash my hands because I don't know what this patient has. And two, I might need to consider cleaning. C. diff has to be cleaned with a bleach-based product, essentially. So I might need to consider looking for a different cleaning product because I don't know. And a lot of times, these people, especially if it's new onset, won't realize that they actually have C. diff. So just getting that kind of thought process in your head, like something like that. Of course, it could be the norovirus where it's just a stomach flu, but it also could be something like C. diff. So, sorry, Stephanie, go ahead and
No,
finish.
you're fine. And the new emerging threat is the Candida aureus. That is hard to detect and it's also very hard to treat. And so again, making sure that we are cleaning everything to the best that we can so we aren't spreading that is extremely important. Next
So
slide.
this, yeah, just
Sorry.
this new Candida auris is it's coming in from the coast. So they're having kind of a state by state. All of a sudden, these states have it. The closest one, last I checked, I believe was now Iowa has detected this in their facilities. The problem with this is there's not a lot of testing. We don't have a definite treatment yet for it. Like Stephanie said, knowing whether it's this or something such as a common cold or respiratory virus is very, very hard to distinguish right now. But the big thing with this one is it requires a different class of cleaning products. Stephanie mentioned that EPA product that has to clean certain things. This has to come off of a list P cleaning product. So the CDC is just issuing warnings about this. You guys are going to be hearing a whole lot more about this right here being a concern and what our next steps are going to be across the nation for protecting from this. So just a heads up.
Alrighty, antibiotic stewardship. Make sure that your office does have this. What does it look like in your office when you start? Using antibiotics is something that dental clinics do, dentists do. They use before dental procedures, and they'll also use it for treatment of dental infections. So you have to make sure though that you're using the antibiotics appropriately. And I know doctors will be prescribing that and stuff, but it's always good to have in the back of your mind that, are we using it appropriately? Are we using it for the correct time? Is it the right dose? That's all part of what goes into the antibiotic stewardship to making sure that we're not building resistance up to certain antibiotics.
The other thing that a lot of dentists and dental facilities do is it has been used prophylactically or prior to a treatment. For somebody that's had something, let's say like a knee replacement, a hip replacement, something like that, they automatically would prescribe antibiotics to try to ward off an infection in these replacement parts like the hip or the knee. However, now they're saying there's certain types of antibiotics that shouldn't be used prophylactically, and even starting to consider whether or not we should be using these at all versus going ahead with the treatment and seeing where the patient goes. Just because overuse of antibiotics is such a huge concern right now, because if you use antibiotics too much, it might not treat the next thing that you have where you need an antibiotic. Your body almost gets used to it and it doesn't respond anymore. So that's why antibiotic stewardship is becoming a huge thing across the healthcare setting and pulling in the dental setting with it.
Alrighty, these are some of the posters that we have out on our website, our Project First Line website. You can go on and print these off. These are always good resources to have to hang up in your offices. Just good reminders of where the risks are, what the germs are, what we are doing in healthcare that potentially could expose us. And then what are some actions that we can take to reduce the risk? Germs are out there and we do have to protect ourselves. Plus we also have to protect our patients too. So any questions? Does anybody have anything they want to share? Like Jess said, you guys are a pretty quiet group. There's our website there if you guys want to go and look at those posters. We have other interactive, like just started off with what are wrong with these pictures. There's some good ones there. Plus we have like diarrhea dilemma, Felix, how
Like
to
fidgeting Felix, putting in an IV
fidget,
practices,
yep,
things like that.
yep. So good resources out there on the website for you to use if need be.
And just keep in
Okay.
mind while you're in school, you might not need it because you're not in the dental setting right now, but if you're needing this for research or anything like that, everything on our website is CDC approved materials. So this stuff is the standards that are going by across the nation. So the stuff on those posters, on the resources are all valid and usable objects for educational purposes. If you guys don't have any questions, if you have time and the capability, we'd love it if you would scan this QR code and just take our survey. Since we're a part of the CDC, we have to report back every training we do and how many and if it was useful or not. So other than that, we will let you guys wrap it up unless there's questions.
Any questions, students? No? Okay. Well, that was a very good presentation. Very informative. So thank you, Jess and Stephanie. We appreciate you coming on this morning.
Absolutely. Thanks for having us. I will send this to you so you have it to share out if you'd like.
Oh, that'd be awesome. Thank you.
All right. Thanks, guys.
All
Have a
right.
good day.
Thank you.
You too. Thank you. Bye-bye.
Bye. Okay.